Kia ora, and welcome to this educational series covering the Trauma Tertiary Survey. In this series, we will discuss the reasons to perform a tertiary survey and explain how to conduct a tertiary survey. We have divided up the learning material into small segments focusing on each body region. You can view each section individually, although we do recommend watching from start to finish if you are new to tertiary surveys and trauma management. These are learning resources to help you develop your skills. We recognise that there are multiple acceptable ways to practice, and this is one of those ways. There may be also regional variations in practice, and we recommend you consult your local or regional guidelines. If you are watching this video on YouTube, please hit the like and subscribe buttons, share the link to this video to your colleagues if you think they will find it helpful for their trauma practice, and leave a comment if you have any suggestions for improvement. In this introductory module, we will learn the types of examination in trauma, describe what a trauma tertiary survey is, and explain why and when this should be performed. Trauma patients can have a multitude of injuries. Traditionally, we examine patients by prioritizing the detection and management of life-threatening injuries before moving on to less serious injuries. The primary survey detects life threats, and we address those. Once those have been addressed, we move on to a complete head-to-toe evaluation of injuries, which is the secondary survey. The tertiary survey is a complete re-examination of the patient and review of all of their injuries, investigations, and management to date. Missed injuries are commoner than we think. In some series, this can be as high as 40 to 50% of patients. Sometimes these injuries can lead to longer-term problems for those patients, including financial and psychological stress, even if they weren't initially life or limb-threatening injuries. For this reason, it is important to make concerted efforts to detect all of the sequelae of trauma as early as possible during the trauma patient's admission. The performance of a trauma tertiary survey reduces the risk of this happening. Our assessment of patients relies on their feedback and cooperation. It is hard to diagnose what is diseased or damaged if we don't know where to look, and if our patients are unable to tell us their symptoms. This can occur for a variety of reasons. Patients with traumatic brain injury, intoxication, or those who need emergency surgery are more likely to have missed injuries because we may have been focused on life or limb threats, and they may not have undergone a comprehensive secondary survey. A tertiary survey is typically performed within 24 hours of admission to hospital. In severely injured or intoxicated patients, it may not be possible to complete all aspects of the tertiary survey. We recommend repeating the tertiary survey when the patient is alert and cooperative if they weren't at the time of the initial tertiary survey. The tertiary survey reviews the relevant history to date, interventions performed, as well as a complete re-examination of the patient. All of the imaging, laboratory results and reports are reviewed. We use this information to document a summary of problems and make a management plan. Later, the data arising from tertiary surveys can be used in audit or research to improve our care of trauma patients in the longer term. The trauma tertiary survey includes a head-to-toe physical examination. These examinations can be time-consuming and will need to be counterbalanced against your clinical workload. With practice, you can become quite efficient in performing these examinations and documenting your findings. To save time, it's best to simplify the examination into a screening evaluation with a more thorough or specialist examination occurring if injuries or abnormalities are found. Have a systematic approach and you'll avoid missing injuries. To save time, bring a fellow RMO, registered nurse, or healthcare worker to document your findings as you go. If you are new to performing these tertiary surveys, we recommend pairing up with a more experienced colleague so as to not miss subtle findings. Before starting the examination, you should explain to the patient what you will be doing and gain consent for the examination, ensure that they're stable enough to perform an examination, and ensure that they're comfortable and have adequate analgesia before beginning. You can employ any structures to the examination that you are comfortable with. We recommend the look, feel, test system to examine each part of the body. In each of the learning modules, we have suggested a recommended structure to your exam. You can tailor this to the circumstances appropriate for each patient. Some examinations, for example a neurological examination, are repeated in multiple modules. You do not need to perform duplicate examinations if a particular system or body part has already been examined. We have presented a recommended structure to aid your examination in trauma patients. As you become more experienced, you may be able to perform multiple parts of the examination simultaneously. This concludes the introductory module. One of the aims of this learning resource is to demystify trauma care. Share this resource with your colleagues and pass on what you have learned to others. There are no secrets to good trauma management, and thus this is a free open access medical resource. If you're watching this on YouTube, please like and subscribe to this video. We appreciate any feedback you may have on this learning resource. Please send your feedback to the email shown. We hope you enjoy the series as much as we enjoyed producing it.